Hypersensitivity. Hypersensitivity is exaggerated to inappropriate state of normal immune system. It leads to onself of advanced effect on the body. Type of hypersensitivity. Type 1 anaphylactic reaction. Type 2 cytotoxic antibody mediated reaction. Type 3 immune complex mediated reaction. Type 4 delayed T cell mediated reaction. Here type 1, type 2, type 3 hypersensitivity reaction mediated by B cell. Type 4 hypersensitivity reaction mediated by T cell. Type 1 hypersensitivity. Anaphylactic reaction. It is kind of rapidly developing anaphylactic immune response given by the body to antigen, allergen, to which the individual is previously sensitized in the mediated by humoral antibody IgF type. This reaction which 15 to 30 minutes. Exposure to antigen. Pathogenesis. First contact of host with the antigen. Initial contact with antigen activate the circulating B lymphocyte, lead to formation of Ig antibody. They get attached to the surface of mast cell, basophili, eosinophils. These cells are non-fully sensitized for the next similar exposure of antigen. During second exposure with the same antigen, the sensation cell set in the cell range of the related antigen structure. Example: bronchial asthma due to inhalated allergen, urticaria due to continuous anaphylaxis, food allergen due to ingestion to allergen like fish, cow milk, etc., sting in the honeybee. Type 2 hypersensitivity. It is a reaction by humoral antibodies that attack the cell surface antigen on specific cell and tissue, leading to destruction of the target cell. It is mediated by IgM or IgG antibody. Pathogenesis. Antigen on the surface of target cell, foreign cell with antibody IgM IgG. It form antigen-antibody complex. Further, this complex link with the complementary, the overall lead to activation of complementary system. Opsonization take place. Phagocytosis of target cell, lysis of target cell. Example: mismatched blood transfusion, incompatibility, transfusion reaction, autoimmune hemolytic anemia, erythroblastosis fetalis, Graves disease, myasthenia gravis. Type 3 hypersensitivity reaction, immune complex mediated reaction. It results due to deposition of antigen-antibody complex on the tissue along with the activation of complementary system and inflammation reaction which result in the cell injury. It is mediated by IgG or IgM antibody. The major etiological factor for the type 3 hypersensitivity reaction: persistent low-grade microbial infection, extinct environmental antigen, autoimmune process. Both type 2 type 3 hypersensitivity reaction have allergen antibody complex formation. The major difference is type 2 reaction is tissue specific, which type 3 reaction is non-tissue specific. Pathogenesis. Immune complex is formed between soluble antibody, soluble/insoluble antigen. This complex get deposited into the tissue. Further antibody link with complementary activate the classical pathway. The result in attraction of various cytokine macrophage neutrophils. Lead to inflammatory and tissue destruction. Example: systemic lupus erythematous SLE, rheumatoid arthritis, post-streptococcal glomerulonephritis. Hypersensitivity. Delayed T cell mediated hypersensitivity. It is T cell mediated response which formation antibody. It is delayed type of reaction occurring about 24 hours after the exposure to the antigen. The effect is prolonged which may lead to several weeks. Pathogenesis. Antigen is recognized by cytotoxic T cell, CD8 cell. Antigen is further processed by presenting cell. The antigen presenting cell are further linked with the helper T cell, CD4 cell. This helper T cell further release cytokinin which activate the macrophage and inflammatory mediator enzyme. This further lead to target cell destruction. Example: Montauk's reaction, reaction antigen transplant organ, type 1 diabetic mellitus, reaction against malignant cell in the body, multiple sclerosis.